In this video, I will talk about big picture treatment plan for diabetes type 2, but it's going to be done through the treatment plan for the digestive tract, because one of my subscribers asked me a question: can I create a video for the person with diabetes type 2 that has acid reflux and constipation? So let's talk about complications of diabetes type 2, of gastrointestinal complication. The most common is gastroparesis. Fancy word, means that abnormal movement of the stomach. The second one, intestinal enteropathy, is a very general term for the inflammation of intestines of the digestive tract. Now, guys, I will be talking about the treatment plan, and I want to tell you that the treatment have to include not only the sugar control. The sugar is not the only cause of diabetes type 2. And my goal is to make sure that you understand that. There are other items that needs to be fixed. So I will talk about that. But here is I will be talking about the plan. It's have to include complex carbohydrates, nuts and seeds, probiotic, trace minerals, magnesium, cooked fruits and vegetables, and seaweed. I will explain why. Now, let's go. The pathogenesis of peripheral neuropathy in diabetes type 2, or let's say it simply, the damage to the nerves is that done due to diabetes type 2 in people. Mechanism is the same. As you can see on this picture A, this is the damage that done to peripheral nerves of feet and hands. It's absolutely the same mechanism as would be done to heart, digestive tract, and urinary tract. But clinical presentation is organ specific, meaning that if the damage done to peripheral nerves, this person will complain about decreased sensation on the fingers and toes. As a result, person will probably be presented in the office setting complaining about tripping on the floor and then falling. In this case, the person will be presented with acid reflux, constipation, diarrhea, and gas. Now, let's go to the PowerPoint presentation, and I will give you a little bit of background explanation. As always, I pre-draw my favorite picture of digestive tract, but today we are going to talk about sympathetic and parasympathetic system. This is the brain, and by the way, I have a YouTube video on my playlist where I explain the effect of sympathetic and parasympathetic system on our digestive tract. Out of the brain, parasympathetic system comes and supplies the digestive tract. The purpose of and it supplies every single part of the digestive tract with the nerves. The purpose of the parasympathetic system in this case is, number one, to make sure the digestive tract is moving, so movement. And if you recall the video, the movement of the digestive tract have to be, must, from the top to the bottom. So the muscles will contract and move the food from the top to the bottom and eventually out. Nothing could be moved in opposite direction. Number two is production of juices. And juices that produced under effect of parasympathetic system are numerous. Number one is hydrochloric acid in the stomach, HCl. Then from the liver is bile get produced into small intestine that help to digest fat. The pancreas will produce pancreatic enzymes that will help to digest food further. Eventually, food will be absorbed. Digestive tract is heavily supplied by blood, and I will draw it red. The purpose of the blood here, well, blood vessels is actually has two, in this case, two purposes, right? Number one, when the food get broken down in the digestive tract, it will get absorbed into the bloodstream and deliver it all over the body. The second purpose is this blood supply brings the oxygen to every single cell of the digestive tract, and it will supply the nerve sympathetic and parasympathetic nerves here of the digestive tract. So this blood supply comes right into these nerves because they need oxygen. This oxygen is a source of life. So I will draw one more. So there's a blood supply to the nerves. Now, what happened in diabetes type 2? There is a process that's called glycation. When the sugar is high, it gets combined with the protein. And the combination sugar-protein creates an internal kind of almost like a plastic layer. As a result, oxygen cannot go out of the bloodstream, and the food cannot get absorbed. So as a result, the nerves of parasympathetic system that get supplied with the blood, they don't have enough blood supply. They don't have enough food supply. As a result, they start to die. What's the consequences? Here we go. Number one, movement is going, and it's gone. For some people, it may take up to 10 years before you see the clinical symptoms. It depends on the concentration of the sugar in the bloodstream. What the consequences of abnormal movement? So stomach, rather than contracting from the top to the bottom and moving food from there into the small intestine, it will start to contract in different direction. As it contracts, a little bit hydrochloric acid and undigested food will go through the lower esophageal sphincter. It will create inflammation in the esophagus. This is the acid reflux. All right. Then we will start to produce much less or almost no juices. So what's going on? Hydrochloric acid is gone. Cannot digest protein in the stomach. Concentration of the bile or amount of the bile that get produced decreased. Pancreatic enzymes, much smaller amount get produced. Food is staying here in the digestive tract without moving. What will happen? The food becomes rotten. The bacteria that lives here, right in here in the digestive tract, good bacteria that helps us to digest food, start to die. Pathogenic bacteria thriving in this environment. So what happened is dysbiosis. Dysbiosis. So you can see the consequences of the lack of supply oxygen and nutrients into the nerves. So nerves are basically dying. Okay, let's go back to the blackboard. Oops. Okay. I actually meant to say, let's go back to the PowerPoint presentation. So the treatment, big picture, tight control of the glucose intake or sugar intake. So you can see picture here, all soft drinks, juices have to go. All chemical sugar substitution have to go. Bread, pasta, pizza, ice cream, everything that you see on this picture, maybe except I see here is tomato. You can leave the tomato and maybe coffee if it has no sugar. Number two, incorporate into your diet complex carbohydrates and seaweeds. And number three, treat digestive tract symptomatically. So, you know, now we are going to control sugar. Let's talk a little bit more what else needs to be done. Now, the complex carbohydrates, they will have vitamins and minerals. I want the whole grains. I want quinoa. I want buckwheat. I want triticale. I want to have a brown rice. So I want this vitamins and minerals from these whole grains. I want to have a good fat, comes omega-3, nuts, seeds, fish, avocado, probiotic, trace minerals, magnesium, cooked vegetables, and seaweed. Now, guys, we are going into really heavy lifting now. You're going to learn a little bit about diabetes type 2. Here on this picture, you see a cell. This is called lipid bilayer, two blue lines. It's membrane, cellular membrane. This inside is nucleus where genetic information is stored. This is an insulin receptor. It has three parts: external, through the membrane, and internal. when the insulin and the sugar, they come together and sit on this external part, they get internalized inside the cell because the receptor get activated. This activation will send the signal into the nucleus, genetic information, and will tell our cell, plenty of energy, plenty of sugar, time to grow and reproduce. So, and the cell will start to grow and reproduce. By the way, this is the receptor also that connects to cancer pathways. So when they get activated due to ultraviolet radiation or some chemical insult, it also sends the signal, hey cell, if you will have plenty of, if you have needs to grow and reproduce fast, that's what cancer cells do, we have plenty of sugar for you. So that's what is happening. Now, let's go to the next slide. Here is the process. This is, by the way, the same as receptor is a previous. You see here insulin receptor, okay, where insulin and sugar will come and sit. Internal part, in order to open that for the insulin and sugar to go actually inside where insulin and sugar will be separated, will go in different directions. Sugar will go in and will be used, and insulin will go in different directions and will be expelled out of the cell. In order to activate that, in order to happen, you need magnesium. And magnesium have to come from someplace. It have to come from outside the cell. And there is the interesting mechanism, this one, when magnesium comes in only when the sodium and calcium can come out. So I put the slide here for a good reason. You need to understand, if person is deficient either in calcium, sodium, which is unlikely person will be deficient in sodium, or magnesium, the activation of this internal part that will actually open the receptor and will permit sugar come in and insulin is not going to happen. Okay, as a result, insulin and sugar will be floating outside the cell. So both will be elevated, insulin and the sugar. Now here on the left, there is a more complicated picture, just because more complicated. Here is example of the importance of the zinc. Zinc comes in through the cell membrane, and it's actually participates in activation, this internal part of tyrosine kinase, part of the receptor that helps to open that gate and let insulin and the sugar inside the cell. If the zinc is not there, the receptor remains inactive. As a result, sugar will be and insulin elevated in the bloodstream. Now, we are going to treat the disease, right? So you understand importance of minerals. Take a supplement, trace minerals, eat whole grains. Those whole grains have vitamins and minerals. Yes, when you will be cooking them, some vitamins will be lost. So take liquid vitamins and supplements of liquid vitamins, just in case. Seaweed has a lot of trace minerals. That's why I want to see. To fix the deficiency of calcium, magnesium, zinc, and other trace minerals may take up to 6 months. People want to see effect like that. It's never happened. So help it with liquid trace minerals. Now, let's treat the digestive tract. You see this word, I kind of highlighted, maybe more fibers. Not every person will benefit from consuming more fibers. Some people may need to help with digestive enzymes or take a probiotic. So, but experiment, see if maybe you can increase the amount of fibers and make sure that your vegetables are cooked, because when there is an inflammation in the digestive tract, it's even you put the raw vegetables there and it will just scratch more and they will contribute more to inflammation. So in the beginning, to calm down the inflammation, eat everything cooked. Okay, magnesium, to deal with magnesium deficiency and also help with constipation. if person has gas and bloating, maybe a little bit enzymes will help. So I have a video on the topic enzymes, which one, how much to take, please see that. Maybe liver flush will have a video on this topic too. Take a probiotic. Okay, acid reflux, slippery elm and marshmallow, just to cover the digestive tract with protective layer. I want that slippery substance from there. Enteropathy, aloe vera will help in general with inflammation. Demulcents, aloe, avocado and okra. Okra also has the slimy stuff in that. Experiment with medications, Gaviscon, Tums, maybe a little bit bitter foods that will stimulate the production of juices. Remember, we need to stimulate that because parasympathetic system is basically dying, right? Experiment with arugula. Experiment with daikon and escarole. Okay, guys, that's it for today. I hope this is helpful. Like, subscribe. All the information about the supplement research in description below. Thank you very much. Bye-bye for now.